Hi everyone, my name is Samantha Decker and welcome to my genetic disorder presentation on phenylketonuria, also known as PKU for short. Just to start off, I wanted to give a brief history about PKU so you could just really know where all this originated. A Norwegian physician named Asbjørn Folling discovered PKU in 1934. A mother had brought her children to see Dr. Folling for consultation. Both of her children were originally normal at birth, but then later became extremely developmentally delayed. The mother noticed that her children also had really strange smelling urine. Dr. Folling analyzed urine from both of the children and realized that instead of their urine turning brown in the presence of ferric chloride like you would expect, or purple, which would be the expected color if ketones were present, indicative of diabetes, their urine turned green. Dr. Folling used chemical analysis to determine what substance was causing the green reaction. The answer was phenylpyruvic acid, which breaks down into phenylacetic acid in the urine. The name phenylketonuria came from the presence of a phenylketone in the urine, phenylacetic acid. In 1939, research indicated that PKU was inherited. It was an inherited disorder that ensued due to the body's failure to metabolize phenylalanine. In 1953, a low-protein diet was instituted for management of PKU, but a screening technique had still not been developed. PKU screening using a simple blood test did not begin until 1963, first in Massachusetts. Today, all infants are screened for PKU. So what exactly is the prevalence of PKU? How often do we see this disorder happening? Well, about 1 in 10,000 in European populations, 1 in 50,000 in African American populations. Additionally, PKU is rare in Japan as well as Finland, and prevalence clearly varies among geographic regions and ethnicities. What are the major characteristics of PKU? At birth, infants with PKU will not display symptoms, but within months the infants will start to show symptoms, becoming uninterested in their environment. For example, they may no longer be interested in eating. They may also not be as interested as playing with their siblings, things like that. If PKU is not diagnosed and continues to go untreated, developmental delay will definitely become apparent by the age of 1. Other symptoms that might arise include odorous breath, skin, or urine due to the presence of extra phenylalanine in the body. PKU infants may also have very fair skin and blue eyes, and this is because phenylalanine cannot be converted to melanin, so they won't have brown eyes or they won't have brown hair. Additional symptoms could include eczema, seizures, and poor growth. What is the molecular cause of PKU? Why does this happen? Well, phenylalanine hydroxylase, PAH gene mutations are responsible for PKU. The PAH gene is found on chromosome 12 in the body, as you can see in this visual representation. Missense mutations encompass a large portion of the mutations responsible for PKU. A missense mutation occurs when there is a modification in a single base pair, causing the exchange of a different amino acid in the resulting protein. This amino acid exchange can have no effect at all, or it might render the protein non-functional. Missense mutations misfold the PAH gene, which causes loss of enzymatic function and increased protein degradation. So how is PKU inherited? PKU is inherited in an autosomal recessive pattern. This means that for an individual to have PKU, they must have 2 copies of the recessive gene for the given disorder, 1 maternal and 1 paternal. Now let's talk about an example. Let's say that 2 people decide that they are going to have a child and they know that they are both considered carriers for PKU. The recessive gene is lowercase p and the dominant gene is capital P. Now these letters are just arbitrary. You could use any letter from the alphabet. But the parent genotypes would be capital P, lowercase p, because as we stated, they are carriers, and their phenotypes would be normal, meaning that they don't have the disorder, they don't show symptoms, but they are carriers, which can pass on the gene to their children. The disorder. If these two parents reproduce, there is a 25% chance the child would have PKU, a 50% chance the child would be a carrier, like they are, and a 25% chance that the child would not have PKU or be a carrier, and this is called homozygous dominant. I just wanted to include a little picture here so you can exactly see what I just described. Here's the dad and here's a mom, and they decide that they're going to have a child. They are both carriers of PKU. They have a 25% chance of having a child with PKU, a 50% chance of having a carrier, and a 25% chance of having neither a child with PKU or a child that is a carrier. Here's an example of a pedigree. This example actually took from my assignment that I did during our course. And I just wanted to do a couple of more examples just so you really get the hang of this. So first, let's look at Sarah and Ryan. As you can see here, the dot indicates a carrier and red indicates a person or individual with PKU. So Sarah is a carrier for PKU, and Sarah is married to Ryan, and they decide that they are going to have a child. If they had a child, they would have a child. There's a 0% chance that they would have a child with PKU. There would be a 50% chance that they would have a child that is a carrier, and there would be a 50% chance that they would have a child that is not a carrier and also does not have PKU. Let's do one more example. Let's look at Jessica and Ron. So as you can see, Jessica does have PKU and Ron doesn't, but he is a carrier. So there would be a 50% chance that if these two individuals had a child, they would have a child with PKU. As you can see here, their child does indeed have PKU. And then they would also have a 50% chance of having a child that is a carrier, which should also be taken into consideration. Moving on to PKU screening. Most commonly, PKU is identified through a blood test after a baby is born. The blood test is simple and is usually completed around 24 to 48 hours after birth and after the baby has consumed some type of protein, milk. A few drops of blood are obtained from the baby and analyzed in the lab for detection of PKU. This is known as the Guthrie test, and you can see an example of this in this photo. In the United States, all 50 states require that newborns are routinely screened for PKU. If a baby is born at home or somewhere where testing is not completed, a visit with a pediatrician should be scheduled promptly so that if the baby does have the disorder, it can be identified early on. Screening newborns for PKU costs approximately $1.25 per test. In the U.S., PKU occurs in approximately 1 in every 10 to 15,000 newborns. This means that it costs approximately $12,500 to $18,750 to identify one case of PKU in the United States. A price well worth it, in my opinion. Moving on to testing, genetic testing. If a parent has PKU or is a carrier or has a family history of the disorder, genetic testing can be completed prior to conception or birth to see what their risk is. There are biochemical and molecular genetic tests to test for PKU. Biochemical tests include enzyme assay and analyte. Enzyme assays measure the disappearance of a substrate or appearance of a product over time. Analyte analyzes for the presence of phenylalanine. Molecular genetic tests include mutation screening of the entire codon region, sequence analysis of select exons, sequence analysis of the entire codon region, deletion/duplication analysis, microsatellite instability testing, and targeted variant analysis. Genetic testing can be completed as early as 10 weeks into pregnancy. Genetic testing costs can vary between $100 to more than $2,000, depending on the type and complexity of the test. One company that offers genetic testing for PKU, Natera, charges based on annual household income and household size, which is nice. For example, a family of 4 with an annual household income of $103,000 or less pays $149 per test, while the same size family with an annual household income of $51,500 would pay absolutely nothing. Insurance coverage is variable, although many insurance companies will pay for genetic counseling or testing when it is recommended by a physician. So why exactly is early detection of PKU so critical? Well, early detection and treatment of PKU is vital to prevent development of severe mental retardation. When PKU is recognized in the initial weeks of life and a phenylalanine restricted diet is implemented, intellectual development is considerably greater. And lastly, here's a list of all of my references. I really enjoyed learning about PKU and everything else that we've learned about in genetics this session, and I hope you have too. Best of luck to everyone. Thank you.